What is with the CBC, especially the CBC with differential? It's a complete blood count with differential. What the differential is breaking down the white blood cells. So I drew a picture here on the right, and if you see, when you draw blood, many times you have to spin it down in the machine. It takes about 5 to 10 minutes to spin it. And when you spin it, you can see the plasma separates from the cells. The plasma takes up more in our body than the actual cells do. The cells consist of red blood cells, white blood cells, thrombocytes, which are platelets. And then the plasma consists of proteins, albumin, which is plasma, and as well as water. All right, but we're not going to talk about that. We're going to talk specifically about the WBCs and how it pertains to the specific case. Because when you order a CBC with differential, with this particular patient coming in, we want to figure out what it means when the results come back. Because we are suspecting some type of infection, most likely, considering the story that we have seen from the patient. WBCs are called leukocytes. Normal is approximately 4,300 to 10,000 cubic millimeter. So it's basically a measurement, how many are in each cubic millimeter. So we know that they're really tiny. Part of the differential, though, is the breakdown of these leukocytes into bands, neutrophils, eosinophils, monocytes, and lymphocytes. That all equals 100%. So these will add up to 100% when you're reading it, give or take a percent or two. It measures the various types of WBCs present, as said on this slide. It adds up to 100, and they can fluctuate depending on the disease. So it can fluctuate day by day. Let's talk about neutrophils. Neutrophils arrive first to the site. They destroy and ingest bacteria. Their lifespan, though, is pretty short, approximately 10 hours. So if you have any cut, wound, or infection, cellulitis, they're the first to arrive. So you'll see neutrophils elevated on your differential, and that will tell me that you have an active infection. Now, if somebody has bands are basically just immature neutrophils. So if we look inside this one here, this purplish thing, that is a neutrophil or a band. Bands are basically baby neutrophils. Now, if those are being released, then you know that there's pretty much a big infection going on, that your body feels that it needs to even release the immature cells to go and fight the injury or inflammation or infection. If you ever heard of left shift, there's a couple different reasons why it's called left shift. One theory is the left shift is from documentation from years ago. People had a graph and you'd put the bands on the left side. They called it left shift. Another one has to do with the shift of the bands being released versus the neutrophils. Not every CBC with differential will show bands, because if there's bands, that tells me there's an infection. If there's no bands and no neutrophils, that's a good thing, because that tells me that this person does not have anything in the bloodstream to be septic. Eosinophils, those are found in skin, airway, and the bloodstream. Most commonly see this with allergies. Can also be seen with inflammation, which coincides with allergies a lot, as well as parasitic infections, not as common. Basophils are found in the blood also, but they're also in tissues, the GI, respiratory, and skin. They're called mast cells when they're in the skin. The unique thing about basophils is they contain heparin and histamine and can contribute to preventing clotting in the microcirculation. So when we think about the COVID-19, it's a very sophisticated virus, as we've had some issues with blood clotting in the circulation and immune complexes and other things contributing to that. So just ponder that. It's interesting. Monocytes. These arrive at the injury site greater than 5 hours from time of injury. So the neutrophils come first, monocytes come second, and they remove the dead or injured cells or microorganisms, especially bacteria or viral. And then last but not least is lymphocytes, which you'll most often see elevated or decreased on a differential. These fight viral infections usually. When we think about the humoral and cellular immunity, B cells and T cells. So we'll see this a lot with viruses if it's elevated. These are most common examples. If we see an elevated WBC, over the 10,000, we think they have a bacterial infection. If it's low, we think it's viral. When we see an increase in lymphocytes, we think bacterial or viral, which I should put, or viral. It's usually viral if it's elevated, low if it's bacterial, but eosinophils, usually allergies, increased monocytes, bacterial or viral, increased neutrophils, bacterial, and bands, bacterial. Sometimes viral, but usually you'll see these show up when they have if they're septic, have a severe bacterial infection. Again, these don't always show up because think about what they are and what they do. Let's break down these steps even more. So you see these orders here. We have to put these in order. What comes